This is an orthokeratology case where the patient's gone through a few lenses now and most recently has some induced cylinder on the cornea. If we look at the posterior topography, you can see that it's pretty loose in the periphery. This lens is moving around quite a bit. That's probably contributing to the oval shape of the optic zone, even though in the lens we're using a spherical optic zone. In the left lens, the zone looks a little bit better. The lens does look a little bit better aligned in the periphery, but again, still a little bit loose. And I think that's what's causing the issues with this current patient. So we want to stabilize this lens. I believe the current lens the patient's wearing is a G-SIM lens. I would go back to a freeform design. As we visited this case in the past, I've seen some better looking posterior topographies with a freeform lens, and so I'd recommend going back to that. The other option is also to do a semiscleral, which will be very stable in the very little motion. But I'm not sure if that's necessary, and that's not the best option for all patients either. So here's a lens for the patient's right eye. So you can see I've gone back to a freeform design. Inferiorly, we can see there's more lens mass. I put prism ballast into this lens, and I would recommend as you order this lens from the lab to leave them a note asking them to dot the lens at the prism location. This will help us to ensure that the lens is lining up correctly. A G-SIM lens can rotate 180 degrees without any problem. It would be equivalent. However, a freeform lens, there's only one orientation on the eye where it gives us our desired or expected effect. And so I like having a dot on the lens so that I know for sure, and the patient also knows whether the lens is lining up. I went with a fairly thin edge thickness and a normal center thickness, 11.4 diameter, 1.5 topo demand. One other thing I did was I went to the front view and reduced the front OZ as much as possible. This is as small as it goes, and this just helps to thin out the lens a little bit where we don't need a whole lot of mass superiorly or in the temporal and or the lateral aspects of the lens. We just need mass inferiorly. We don't need this lens to be too thick since it's being worn overnight. Also in the vertical meridian in 15% mode, I click down 5 times here to tighten up the lens superiorly and inferiorly. Oftentimes the lens that rocks, that doesn't seal well in the vertical meridian, will induce cylinder, so this should help to reduce that. So I think with a lens that moves less on the eye, we should get a better looking alignment zone out in the periphery and a better looking treatment zone with less of the induced cylinder at the corneal apex. So hopefully this is helpful. Best of luck with your patient, and thanks for watching.